So let's look at the skull. When we look at the skull, we have the head, the bony portion of the head, we have to differentiate between the skull cap, which is the calvarium, or is also known as the calvarium, and that consists of a few bones. The frontal bone in the front of us, that's right here. The parietal bone, that's two of them actually, they're bones, they're on the side here. Then we have two temporal bones, which are these ones right here, that include the outside of the ear part. We have one occipital bone, that's the bone in the back of us. And then we got a couple of weird ones. We got a sphenoid, and the sphenoid you can see right here is depicted on the side. And it goes straight through from side to side. So that's a bone that lies within the head, within the skull. It creates part of the floor of the skull. And then we have the ethmoid bone, and the ethmoid bone is really hard to see. You can't really see it in here. It's inside the nose, deep inside the nose. It's a very, very thin boned bone. You can see it on the real skull in the other movie that I have. And then besides those bones, we have then the facial bones. The facial bones make up the face. We have the maxilla right here on top. We have the palatine bones. They are deeper inside. We're going to get to those. We have the nasal bone, which is nice. They make up the nose, so that works together well. It's not that difficult to make that one up. Then we got lacrimal bones, also very small ones on the inside. We'll see them. We have the zygomatic bone, and that's our cheekbone, essentially, right here. And then we have, in the inside of the nose, we have some other bones there. The ethmoid bone makes some of these things here that are rounded. Those are turbinates that help circulate the air as we inhale. But then we also have one of these round things on the bottom here, and that's known as the inferior nasal concha. And then we have the vomer bone that sits inside the nose also, and the next one we can actually see, that's the mandible. That's the big round jaw bone that we have. Alright, well, let's go through the calvarium first. The frontal bone, here you see it nicely greenly laid out. It forms the forehead. A few things we have on there that we want to note, some landmarks. We have the superciliary arches. They are right here, the arches that make up the eyebrow end of the eye here. So there's a little excess bone. Then we have the glabella. The glabella is a hairless portion between the superciliary arches in just above on the nose. Then we have the roof of the orbit, which is the eye socket. So that's what makes partly up what is behind the eye, the bony portion. And then it forms the anterior fossa of the base of the skull. So it's by having the orbit here, the roof of the orbit, on the other side where the brain is, we have the inside, and that's partly formed by that frontal bone. And that portion here in the front is called the anterior fossa or cranial fossa. And then as we move posterior, this picture, to make it clear, is a cut open skull. We look from above down. And so besides the anterior cranial fossa in the front, we have a middle one that is actually, a lot of that is done by the sphenoid bone, and also the temporal bone. And then we have one in the back, and that's the posterior cranial fossa, and a lot of that is made up by the occipital bone. So the anterior cranial fossa, a large portion is made up by the frontal bone. And then the frontal bone also houses the frontal sinuses. And you can see that right here. These purplish ones are the frontal sinuses. And sinuses are chambers within the bones to lighten the bone but also to create resonant chambers for the voice um, in part. The parietal bone. The parietal bone lies on the side of the skull, behind the frontal bone. On the sides, this would be then the temporal bone coming in, and in the back is the occipital bone here. It means wall. Okay, we can handle that. It's one on each side. There is a place that is a little bit protruding. It's not really feeling it that much, but it's called the parietal eminence. And that is the widest portion of the skull. And so that's important when the baby is born. That needs to be squeezed together in that end. So it needs to be soft. Those sutures those connections between the skull plates that are surrounding the parietal bone need to be soft enough that the parietal bone can be squeezed a little bit as the baby's born. So the parietal eminence is the widest portion of the skull. The superior temporal line is below that, and that is, you can't really see it or feel it that well, but it's an attachment site of the temporal muscle, the temporalis muscle right here that helps in chewing. And so if you actually clench your teeth together and then find on the side of your skull, push there, and there's a little bit of muscle bulging that happens, and you can feel that. So where that muscle attaches on the parietal bone is the superior temporal line. Well, that brings us to the slide of sutures. And sutures are joints between skull bones. You can see how they are formed here. The jaggedy lines go in and out. That forms a joint that looks like it's just a fusion, but it is not quite a fusion. There's a little bit of movement in between those joints, and that has been shown when they go in post-mortem and they look at the sutures, and they find not only bone cells but also some connective tissue cells, fiber cells within those areas, and so they know there's a little bit of movement going on. Craniosacral therapy works with that movement, by the way. But we have a few sutures. We have 4 that I would like to look at, and we have coronal suture, that's in the front, between the frontal bone and the parietal bone, it's like that. Corona means crown, so you just picture that, a crown going up and around like in a Jesus picture, not for a king. Then we have a sagittal suture, and the sagittal suture separates the parietal bones, that's on top of the head, and you can feel that very often. Then the lambdoidal suture is in the back. I don't have a picture of the back, but the way that the sagittal suture comes together and the lambdoid suture is around between the parietal and the occipital bone, it looks like a lambda, which is an upside down Y in the Greek alphabet. And then lastly we have the squamous suture, and the squamous suture is on the side right here between the temporal and the parietal bone. And it is a suture that is not sort of the same jaggedy way up and down. It is more of a flat suture where the parietal bone goes underneath a little bit of the temporal bone as they connect. You can see that in the lab. And before the sutures are created, and that's, I was talking before about that, when we have to get the skull out of the mom, we got to squeeze a little bit. And it's a process that's quite intense. So they're not fully formed. The sutures are not fully formed. But what we have is we have soft tissue that connecting the bones together and creating soft spot where that soft tissue is. And those soft spots are called fontanelles. And they also, besides the birthing, in an early stages of development, we have a rapid growth of the brain right after birth for a few years. And so we need to let that brain be able to be grown and not have the bone and push against it that it cannot grow. So the fontanelles also help with that, with the growth. So we have 2 main ones. We have an anterior fontanelle that we look at here, the tough spot right here, and then we have a posterior fontanelle in the back there. Alright, so let's leave it at that, and we'll continue the temporal bone next.